Have you ever found yourself cursing that pesky foot pain that just won't quit? If you've been feeling a strange tingling or pain in the ball of your foot, you might be dealing with something called a Morton's neuroma. I'm Houston podiatrist Dr. Andrew Schneider. I'm board certified with over 20 years of experience. This condition happens when the tissues around the nerve in the ball of your foot enlarges, usually between your third and fourth toes. It's not just your typical foot fatigue or a simple sprain, and it's more common than you'd think. In this video, I'll discuss how a Morton's neuroma forms, how it can be diagnosed, and most importantly, treated. I wrote a book all about Morton's neuromas and all other causes of balls of the foot pain. I'd like to send it to you as a gift. Visit www.balloffootbook.com and I'll send it to you at no charge. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. A Morton's neuroma is an enlargement of the nerve that travels between your metatarsal bones. Although it's most commonly found between the third and fourth toes, it can happen in any interspace. The pain starts when the nerve becomes inflamed. A Morton's neuroma can be caused by irritation or damage to the nerve from mechanical stress. Things like narrow running shoes, overtraining, tight calves, flat feet, or even bunions might trigger it. A Morton's neuroma has nothing to do with age. It's not uncommon for it to affect anyone of any age. It's more common in women, however. That's likely because of the narrow nature of women's shoes. Symptoms of a Morton's neuroma can range from a burning sensation in the ball of your foot, feeling like you're standing on a pebble, or worse, razor blades. Some people may experience tingling or numbness in their toes, and the discomfort can range from a sharp stabbing pain to dull, numb sensation. And it may worsen when you're walking or wearing shoes that squeeze your toes. Despite the pain, there's usually no noticeable swelling. If you're experiencing these symptoms, it's important to consult your podiatrist. I would thoroughly examine your foot, use x-rays, ultrasound, or possibly an MRI to rule out other causes of ball of the foot pain, like a stress fracture or capsulitis. An accurate diagnosis is key to finding the most effective treatment. Now, if you've been diagnosed with Morton's neuroma, don't panic. There are several treatment options available. Switching your shoes, taking anti-inflammatory medication, and wearing insoles that support the ball of your foot can help. Steroid injections might be used to calm the nerve. At home, you could use ice, elevate your foot, use insoles or pads, or take an anti-inflammatory medication, or even apply an anti-inflammatory gel. You can also consider engaging in low-impact activities like swimming until you can get in control of your condition. Extracorporeal shockwave therapy has emerged as a promising, non-invasive treatment option for Morton's neuroma. It involves the application of acoustic shockwaves to the affected area, which stimulates blood flow, accelerates tissue repair, and reduces inflammation. When used to treat Morton's neuroma, shockwave therapy targets the affected nerve, helping to break down the scar tissue and promote healing. In my practice, many patients experience significant pain relief from a Morton's neuroma through shockwave therapy. Shockwave therapy is non-invasive and painless, and it makes it an attractive treatment option for those seeking relief from Morton's neuroma without the risk associated with a more invasive procedure. Prevention is always better than cure. Try wearing the widest width shoes that will stay on your feet. This will prevent the shoes squeezing your forefoot and put more pressure on the nerve. You can also wear an insole with a metatarsal pad to relieve pressure on the nerve. The long-term prognosis of Morton's neuroma is pretty good. Around 1/3 of people improve with just changes in footwear and metatarsal pads. The symptoms might come and go over a few years, but with proper care and rest, you can manage flare-ups effectively. However, if untreated, it can lead to chronic pain in the ball of your foot, so don't ignore persistent foot pain. In cases that are unresponsive to conservative care, you may need surgery. Surgical intervention for Morton's neuroma involves the removal of the affected section of the nerve. Surgical intervention has a very high success rate, but like any surgery, they also carry risks and potential complications. So if you're plagued by persistent ball of foot pain, it might be due to Morton's Neuroma. Remember, you don't have to suffer with this pain. There are solutions available. Don't let foot pain slow you down. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Stop everything and take a minute to order my book, All About Ball of Foot Pain. I'm happy to send it to you as a gift. Visit www.balloffootbook.com to order your free copy. The link is in the description. If you've been suffering from intense ball of the foot pain and think you might have a Morton's Neuroma, give us a call. We'll get to the bottom of the cause of your pain. The link to request an appointment is also in the description. Thanks so much for watching and have a great day.